This is an educational video on the steps to take when caring for an incontinent patient. Upon admission, assess patient for incontinence and determine if they are already on a toileting schedule.
Hello. Hello, Mrs. Dow. My name's Meg, and I'm the nurse that's going to be taking care of you today. I'm going to assess you for urinary incontinence. Have you had any problems with frequent voiding?
Sometimes.
At home, do you have a toileting schedule?
No.
This first step is vital in improving patient satisfaction and reducing costs to the hospital. Not every patient will require an incontinence pad, so unnecessary use without prior assessment can result in waste of resources and supplies. This patient is incontinent and does not have a toileting schedule. If they did, you would just continue the home regimen. Is the patient frequently voiding in small amounts or incontinent 3 to 4 times in 4 hours?
Mrs. Doe, because you have been voiding small amounts every 3 to 4 hours, I'm going to place an incontinence pad underneath you. I'm also going to complete a bladder scan to see if your bladder is emptying correctly.
The patient is voiding 3 to 4 times in 4 hours and is incontinent. If this were not the case, an incontinence pad is not advised. If appropriate, place one pad underneath the patient. Current evidence-based research shows a correlation between multiple layers beneath a patient and skin breakdown, resulting in negative outcomes. One pad is recommended. Traditionally, incontinence pads are placed in a rectangular fashion to cover the bed from side to side. But according to the manufacturer, the pad can actually be placed in a diamond position to provide maximum bed linen coverage to avoid leakage. The top third of the pad should be positioned above the patient's waistline. This is the proper way to place an incontinence pad under a patient using the diamond form. Start by folding the pad into a triangle. Ensure that the top third of the pad will be above the patient's waistline. Have the patient roll to one side. Tuck half of the triangle underneath the patient. Have the patient roll to the other side. Then untuck the remaining pieces of the pad. Have the patient roll to their back and smooth out any folds. Note that only one pad needs to be used. Additionally, when you know the patient is incontinent, a bladder scan should be performed. The result of the scan determines the next steps. Does the bladder scan show residual greater than 300 milliliters? Perform hand hygiene. Verify correct patient using 2 identifiers.
Can you please state your name and date of birth for me?
Jane Doe, 12/23/92.
Okay, that matches with your wristband.
Place the patient in a reclining or supine position.
I'm just going to lower the head of the bed.
Clean the probe with isopropyl alcohol or any hospital-approved disinfectant. Turn the bladder scanner on. Select the patient's gender by pressing the male/female button.
Jane, have you ever had a hysterectomy before?
No.
If the patient has had a hysterectomy, select the male gender to avoid an inaccurate measurement. Apply a generous amount of ultrasound gel to the probe, taking care not to incorporate air bubbles that may interfere with transmission. Orient the head icon on the probe toward the patient's head. Place the probe about 1 inch above the symphysis pubis. The bladder cannot be scanned through the pubic bone, and point it toward the bladder, tilting the probe slightly toward the patient's coccyx. If the patient is obese, more pressure may be applied to the probe. Press the scan button on the probe and hold it steady until a beep is heard. The volume measured will be displayed. Verify that on the aiming screen, with the light area on the screen representing the bladder, the crosshairs are centered on the bladder, indicating an accurate probe placement. If the bladder overlaps the side of the crosshairs, the measured volume will be falsely low. Readjust the probe position and rescan until the bladder is properly centered on the aiming screen. Repeat the scan to obtain an accurate placement. Press Done and then Print if a hard copy is desired. If using a newer model, which does not have Done option, save, review the examination, and print the results, or press Home to do another examination. Then turn the scanner off. Remove gel from the patient. Then, clean the probe with isopropyl alcohol or any hospital-approved disinfectant. Perform hand hygiene. Document the procedure in the patient's medical record. No, the scan is not enough to prove a full bladder, but if the residual was greater than 300 milliliters, perform an in and out catheter. Based on the IU Health RNets policy number 1.34, the following interventions are recommended for an incontinent patient. Q2 hour toileting, review 24-hour urinary output and establish voiding patterns, obtain bedside commode, urinal, or bedpan if indicated, consider placement of a condom catheter in males, and implement wound care protocol. Badges with CHUCK acronym were created to help staff remember the steps when caring for an incontinent patient. Remember, do not throw incontinence pads in the dirty linens. Thank you. This concludes the steps in caring for an incontinent patient. For additional details, please refer to the IU Health RNet policy number 1.34.